In this video, we're going to walk through the Iowa Durable Power of Attorney for Healthcare. We're going to take it step by step, line by line, sentence by sentence. And so we begin with the preamble. I, Adam Kenwood of 1741 19th Street, West Tentech, Iowa, 50140, hereby appoint my wife, Barbara Kenwood, as my attorney-in-fact, my agent, and give to my agent the power to make healthcare decisions for me. This power exists only when I am unable, in the judgment of my attending physician, to make those healthcare decisions. The attorney-in-fact must act consistently with my desires as stated in this document or otherwise made known. The first thing I want to call your attention to is that the attorney-in-fact, the person to whom these powers are delegated, is referred to as the agent. And secondly, they are given that power to make healthcare decisions. And the power exists only when I am unable to make those decisions. And that determination is made in the judgment of my attending physician. Any decisions made need to be done consistently with any desires that I have expressed to them either individually or in this particular document. Moving on. Except as otherwise specified in this document gives my agent the power, where otherwise consistent with the laws of the state of Iowa, to consent to my physician not giving health care or stopping health care, which is necessary to keep me alive. This document gives my agent power to make health care decisions on my behalf, including to consent, to refuse to consent, or to withdraw consent to any care, treatment, service, or procedure to maintain, diagnose, or treat a physical or mental condition. This power is subject to any statement of my desires and any limitations included in this document. A couple things we want to notice here. First, note that the agent has the power to consent to the physician. It may seem a little bit subtle here, but the physician does not have the power. The agent has the power, and the agent consents to what the physician recommends. By implication, that means that they can choose not to consent to what the physician is operating or proposing. The document gives the agent the power to make the healthcare decisions on their behalf, and that's really the crux of all of this. We sometimes think that the physician is the one in charge, but under this power of attorney, it is the agent who has the decision-making authority. Moving on. I hereby revoke all prior durable powers of attorney for healthcare decisions. Pretty straightforward there. What we want to avoid is a situation where two different individuals are thinking they are that power of attorney. And the general rule is that the one that has the most recent date of execution is the one that will be adhered to. An optional agent can be named. If the person designated as agent above is unable to serve, I designate the following persons to serve instead. And in this case, we identify Charles Kenwood as the son. Option. Additional provisions. Insert here specific instructions or statement of desires, if any. And this would relate to any specific healthcare concerns. While the form provides for this, it's my suggestion and opinion that this is really a lousy place to place any specific instructions that you may have. The reason is this: people may not be looking for at this particular document to find out what your instructions are. If you have instructions, you are far better served to discuss those with people ahead of time, whether that's your physician or whether that's the agent that you have selected. Organ donation. We'll see this quite a bit. This came about in the 2014 revisions. Yes or no? In the event that medical professionals determine that I may be an organ donor, I agree to the use of life-sustaining procedures, including a ventilator, for the sole purpose and time period required to complete the organ donation. Nothing in this paragraph shall be construed to expand or detract from the laws related to anatomical gifts as outlined in the Iowa Code, Chapter 142C. The purpose of this paragraph is to practically and medically make organ donation possible. You'll see this running throughout the documents for incapacity as they relate to healthcare, and the idea is to, of course, make it more known what your wishes and intent is. Termination of the agent's authority. My agent's authority shall cease to be effective upon my subsequently recovering my capacity to make my own healthcare decisions. Thing to note here, shall cease to be effective. If you recover the ability to make your own healthcare decisions, then they no longer have that authority, and everything is reset to square one. Agent's access to medical records. My agent's authority to access and examine my medical records and to receive information concerning my medical condition and the medical treatments that I have received shall be effective immediately, shall not be effective either by my recovering or by losing the capacity to make my own healthcare decisions, and shall not be affected by my subsequent disability or incapacity. My agent has the right to examine my medical records and to consent to disclosure of such records. A few comments. Again, this is effective immediately. Does this present a risk to you as a patient that the agent you have selected has access to those records immediately? As a practical matter, no, because in every situation that I have encountered, they are not going to release any information unless they have talked to you personally to see whether or not it's okay. If you are able to make that consent yourself, that's fine. But in the event that you aren't available to or aren't able to make those decisions, then this is effective immediately and they can rely upon it at that point. Then to execute the document, it is signed. I, Adam Kenwood, the principal, sign my name to this instrument June such and such 2020, and being first duly sworn, do hereby declare to the undersigned that I am 18 years of age or older, of sound mind, and under no undue constraint or influence. Then a signature. Now, the question comes up, how do we know that signature is good? We have two methods. The first is witnesses. By signing this form, I declare that I sign this form in the presence of the other witness and the principal, and I witness the signing by the principal or other person acting on behalf and at the principal's direction. Witness 1, witness 2. The other option is to have it notarized. State of Iowa, state seal, County of Story, signed and sworn to before me by Adam Kenwood, the principal, this June blank 2020, Notary Public in and for said state. By either having it witnessed or notarized, the document becomes effective. Moving on through the document, authorization for release of protected health information to nominated healthcare attorney in fact. Pursuant to the terms of a durable power of attorney, healthcare decisions, or combined living will and medical power of attorney, healthcare power of attorney, dated June blank 2020, in which the undersigned is the grantor, the power becomes effective in the event of my disability or incapacity. This then goes on for an authorization to release information. I authorize any physician, healthcare professional, dentist, health plan, hospital, clinic, laboratory, pharmacy, or other covered healthcare provider, any insurance company and the Medical Information Bureau, Inc., or other healthcare clearinghouse that has provided treatment or services to me, or that has paid for or is seeking payment from me for such services, to give, disclose, and release to the person or persons designated in this document to act as my agent such of my individually identifiable health information and medical records regarding any past, present, or future medical or mental health condition. There is so much packed in there, I can't think of any way to break it down other than to say that the agent is authorized to receive information and is also authorized to disclose that information. And specifically, what they're looking for is protected information. This includes all specifically protected health information relating to each of the following conditions specifically authorized by me to be disclosed by marking the box with an X or a check mark. Sexually transmitted diseases, acquired immunodeficiency syndrome, AIDS, and human immunodeficiency virus, HIV. Behavioral and mental health, and alcohol, drug, and other substance abuse issues, signed and dated by you as the principal. Again, because these are specific protected information items, they want to have these carved out with specific signature and date from you that you want to have these disclosed. It continues. Relating to my ability to make healthcare decisions, the purpose of this request is to assist in determining whether the person designated to act as my agent should act as my agent. This authorization expires when I die or when revoked by me by a written revocation signed by me and delivered to the entity from which information is being requested prior to the time information is being requested. Key to note is that it's prior to the time being requested. Continuing, I understand I can revoke this authorization by delivering a written statement of revocation to any entity I have authorized to give, disclose, and release information. The revocation is effective only as to those entities to whom the written statement revocation is given, and only after the time of delivery. I also understand that I have the right to inspect the disclosed information at any time. My treatment, payment, enrollment, or eligibility for benefits with an entity that I have authorized to release information is not conditioned on my signing this authorization. I know that once the information I have authorized to be released is released, it is subject to disclosure by the recipient and is no longer protected by the Health Insurance Portability and Accountability Act of 1996 and regulations promulgated pursuant thereto as amended from time to time. This language is difficult, but it is what is required under HIPAA. Note that the revocation is effective only as to those entities to whom it is written and given, and then only after the time of delivery. The authority to act as personal representative. In addition to other powers granted by the healthcare power of attorney, I grant to my agent the power and authority to serve as my personal representative for all purposes of the Health Insurance Portability and Accountability Act of 1996, as amended from time to time, and its regulations, HIPAA, during any time that my agent, hereinafter referred to in subsequent clauses of this paragraph as my HIPAA personal representative, is exercising authority under this document. Again, now we're using a slightly different term from agent, and that is personal representative. Personal representative relates specifically to items under HIPAA. Pursuant to HIPAA, I specifically authorize my HIPAA personal representative to request, receive, and review any information regarding my physical or mental health, including without limitation all HIPAA protected health information, medical and hospital records, to execute on my behalf any authorizations, releases, or other documents that may be required in order to obtain this information and to consent to the disclosure of this information. I further authorize my HIPAA personal representative to execute on my behalf any documents necessary or desirable to implement the healthcare decisions that my HIPAA personal representative is authorized to make under the healthcare power of attorney. Then we have the signature and the authentication, again, either by witnesses or by. Then some general information to round out the documents. A durable power of attorney for healthcare is subject to the provisions of Chapter 144B of the Code of Iowa, and reference should be made to that chapter. The following is a summary of some of the provisions of Chapter 144B of the Code of Iowa. 1. Healthcare means any care, treatment, service, or procedure to maintain, diagnose, or treat an individual's physical or mental condition. Healthcare does not include the provision of nutrition or hydration, except when they are required to be provided parenterally or through intubation. Again, here we're talking about the definition being very broad for what healthcare includes. 2. The following individuals shall not be witnesses for a durable power of attorney for healthcare. These include a healthcare provider attending the principal on the date of execution, an employee of a healthcare provider attending the principal on the date of execution, the individual designated in the durable power of attorney for healthcare as the attorney in fact, an individual who is less than 18 years of age. What we note here going on, one of the witnesses shall be an individual who is not a relative of the principal by blood, marriage, or adoption within the third degree of consanguinity. Again, here we're talking about just the requirements for witnesses. The following individuals shall not be designated as the attorney in fact to make healthcare decisions under a durable power of attorney for healthcare. A healthcare provider attending the principal on the date of execution, an employee of a healthcare provider attending the principal on the date of execution, unless the individual to be designated is related to the principal by blood, marriage, or adoption within the third degree of consanguinity. And again, what we're looking at is who shall not be designated as the attorney in fact. Next, revocation. A durable power of attorney for healthcare may be revoked at any time in any manner by which the principal is able to communicate the intent to revoke without regard to mental or physical condition. Revocation may be made by notifying the attorney in fact orally or in writing. Revocation can also be made by notifying a healthcare provider orally or in writing while that provider is engaged in providing healthcare to the principal. The thing we want to note here in item 1 is without regard to mental or physical condition. This seems a bit confusing, but in just a moment we'll be able to explain that in a little greater clarity. Continuing with revocation, revocation is only effective as to a healthcare provider upon its communication to the provider by the principal or by another to whom the principal has communicated revocation. The healthcare provider is required to document the revocation in the treatment records of the principal. The principal is presumed to have the capacity to revoke a durable power of attorney for healthcare. Unless it provides otherwise, a valid durable power of attorney for healthcare revokes any prior durable power of attorney for healthcare. Going back to the point raised above, the principal is always presumed to have the capacity to revoke. When you stop and think about the purpose of that, it would simply be that we are taking the patient's right to make their own healthcare decisions very seriously, and if there is any indication that they can in fact do so, they can revoke that power of attorney and take the power back. Moving on. Prohibited practices. A healthcare provider, healthcare service plan, insurer, self-insured employee welfare benefit plan, or nonprofit hospital plan shall not condition admission to a facility or the providing of treatment or insurance on the requirement that an individual execute a durable power of attorney for healthcare. A policy of life insurance shall not be legally impaired or invalidated in any manner by the withholding or withdrawing of healthcare pursuant to the direction of an attorney, in fact, appointed pursuant to this chapter. The thing I just want to call your attention to is that admission to a facility cannot be conditioned upon having a power of attorney prepared. Point of fact, I know many of them actually do. Item 7, it is the responsibility of the principal to notify the healthcare provider, doctor, of the terms of the durable power of attorney for healthcare. We really can't emphasize this enough. It is the responsibility of the principal to make sure that the healthcare provider, the physician, is notified of what their intent is and that the power of attorney is in existence. Suggestions after the form is properly signed, witnessed, or notarized. Place the original in a safe place known and accessible to family members or close friends. Provide a true copy to your doctor. Provide a copy or copies to family members. Provide a copy to designated attorney in fact, the agent, and to alternate designated attorneys in fact, if any. The main thing that I think we should take away from all of this is, as you read through this, all we're able to do is to delegate the authority to make medical decisions on your behalf. Nothing in here gives any indication to your agent what those decisions should be or what your preferences are. That really, in my opinion, should be the scope of a conversation that you have with family members or the agent who will be making those decisions.